Hi everyone, good afternoon. Welcome to our February session for our San Joaquin Stanislaus Collaborative. It's great to connect with you all again. So getting started, just a few housekeeping reminders that you all are familiar with. You probably got prompted that the session is getting recorded, and we'll be sure to send out that recording after the session for anyone who wasn't able to make it today. If you would like to, you're more than welcome to update your Zoom name with your name and the name of your organization. And I will also drop in the chat the link to today's deck and where we store all of our documents, so our Google Drive folder, so you have that if you would like to follow along. And then for icebreaker question today, just thought we would keep it light and ask folks maybe what TV show you're currently watching, or if you're not watching a TV show, maybe a book that you're reading. Maybe this will help us for folks that may want some recommendations. I was out traveling and it was very sunny where I was at, and I came back to a ton of rain. So that was a change in weather for sure. We'll also have opportunities for discussion and to get your feedback on various things. So encourage you, if you're able to, either put your thoughts in the chat or unmute. Would love to hear your voice. And with that, I will move us to the next slide. I see some folks are putting shows in the chat, so I'll just share a few that I'm seeing so far. I see John has shared Night of the Seven Kingdoms, Shrinking on Apple TV, Cross on Prime, Bewitched, Person of Interest, Night Agent, Bob's Burgers. Like that's a classic. Awesome. Thank you all for sharing that. Okay, so here is the agenda for today. So after our welcome and level setting, we'll move on to our cross-sector policy and regional updates. So per usual, we'll spend some time just sharing some statewide CPI resources and CalAIM resources. And then we'll also have Sadhna doing a presentation on CalAIM housing data, or data that you can use to support your work and sustainability efforts. For MCP updates, for folks that joined early on, we only have Kaiser on the call today, but if there is information from HealthNet and Health Plan of San Joaquin, we'll make sure to include that in our post-session email. And then we'll also hold some space for regional spotlights, because I feel like we haven't heard from folks as much in the past sessions. So if you have something you would like to share with the group, we'll hold some space for that. Then we're going to move on to sustainability updates. So for folks that were able to join our January session, we did share a sustainability readiness assessment that we walked everyone through, and encourage folks to find a partner and set aside some time to complete. So we'll be using this as an opportunity to kind of highlight that assessment again, and also share some responses that we've gotten so far. And this will be really helpful as we also kind of gear into our March in-person session. So with that, just gonna quickly share our objectives for today. So you'll receive CalAIM resources, we'll share MCP updates, regional highlights, and other key announcements. You'll also learn how to apply local CalAIM related data to inform and sustain housing support services. And we'll also review and discuss findings from the Sustainability Readiness Assessment, encourage you all to participate if you haven't already, and align on next steps moving forward. So with that, we'll move on to our next section. And thank you all for putting things in the chat. I will definitely take a look when I have a second. All right, so getting started with our first update, and all these links will be in the deck. We won't be dropping them in the chat today. but you'll have them for reference if you're in the deck. The first one is is that DHCS did release a series of web pages to help counties, health plans, providers, and community partners track the federal actions that impact Medi-Cal. So they have various information around the federal policy impacts, how that will impact Medi-Cal eligibility, benefits, and other pages on behavioral health, reproductive health, as well as a section on the 1115 waiver and waiver renewals, which we'll spend a little bit of time kind of going through that information. DHCS also released their implementation plan for HR1, so encourage you all, if you have the chance, to kind of look through that and let us know if you have any questions. Also wanted to share that DHCS late last month also released their published the most updated version of the ECM and Community Supports Quarterly Report. And this data covers January 2022 through June of last year. Some highlights from that quarter that we just wanted to uplift for you all was ECM enrollment has increased by 61% compared to Q2, with over 200 members served. ECM enrollment has doubled for youth, children and youth, and community supports has reached more than 500,000 members, delivering more than 1.3 million services. And medically tailored meals and housing support services are still some of the most utilized services. So just want to take a moment to acknowledge that and see these numbers. It's pretty awesome to see. Also, just noting for folks that we did pull out the utilization data for the populations of focus and community support services for San Joaquin and Stanislaus County. We just won't cover them in detail today, but they are in the appendix slides if you want to take a look. I know sometimes it can get buried within the report, so did want to pull that out for folks. And then within that, there's quite a few updates. DHCS also updated the ECM policy guide, which we've linked in the deck. Just noting that they have made refinements and additional clarifications in the policy guide to make sure it's aligned with the DHCS birthing care pathway, as well as upcoming requirements for MCPs to authorize ECM for members that are receiving transitional rent. They've also noted that any new changes that they have made, they have marked in red, so we'll either say updated in January or added. And then an important update that we did want to make sure to uplift with the group is that DHCS has recently opened their 30-day comment period on their 5-year renewal application for the CalAIM Section 1115 demonstration waiver, which we know the current waiver is set to expire in December of this year. So we've linked to the page where you can click for more information. They've included their application as well as wanted to share the process. If you would like to submit comments, we have that email on the side here as well as the subject line. They will be taking comments until March 12th so next month. Have a little less than 30 days now. And also just wanted to pause here if folks have been able to see this announcement, if they have any comments or questions, or if folks have plans to submit comments, just wanted to kind of see where everyone's at with this, or if this is new information. Also okay if we're still processing. But as we go through that, feel free to just put that in the chat. DHCS is also planning to host 2 public hearings to get stakeholder input. So I just pulled that information out in a separate slide for folks that are interested in attending. They'll be having these hearings in person as well as for folks that can't attend. I did include the Teams registration link. So the first hearing is actually going to be occurring this week. Both will be in Sacramento, and we've included that information below. So feel free to check that out if you're interested in attending either in person or virtually. Right, a few more updates before I pass it on. The next update that we wanted to share is Medi-Cal is offering live justice involved trainings to help folks better understand the purpose of the JI Reentry Initiative as well as structure. So they'll be helping folks better understand provider roles and requirements, including participation standards and coordination expectations. Um, do want to note that these trainings are occurring this week. So if you are interested, definitely recommend that you check out the Medi-Cal Learning Portal to get registered, as well as they have more detailed instructions there. And then lastly, have a few TA marketplace updates. So as I'm sure many of you all know, DHCS pretty frequently hosts webinars on the TA marketplace. So if you're interested, they are hosting another webinar on March 18th. For anyone that is approved to be a recipient or interested in learning more about the marketplace, they'll provide an overview of project review timelines. They've also made some updates to the DHCS approved applications, which we'll share in their updated policy guides as well. They'll share other updates and reminders, as well as have an opportunity for a Q&A session. And if you have questions, I have included the TA Marketplace email. And then the last update was around the policy guide. So they have released updated policy guides for both vendors and recipients, and just highlighting the key sections that they have updated here. And I believe before we move on, do want to pause because I know that was a lot of information if anyone has any questions. Okay, so at this point, I will pass it to Sadhna to walk us through our next section.
Thanks, Navneet. Hi, everyone. It's great to join you all again today. So, what I'll be going through a little bit is just talking about data, why it matters for really all providers. But some of the examples I'll be pulling up on are for housing providers. The reason we're having this conversation today is through our arc of sustainability. We're really hoping that all of the providers in the room here and in the region get really comfortable with data, how to use data, and also start, if you haven't already been, talking to each other about what data you have access to. And so as part of that learning journey, what we're going to talk about today is, why does this data matter? We're hoping that when we meet in person, we'll build on this. And also today, I'll have some discussion questions for us to better understand what data folks have access to, how they're utilizing it, and how it can improve your service provision and ultimately your sustainability in the region. Excuse me. So if you click through, some of the reasons why this matters for providers is business planning. Accessing the right types of data will help you have volume projections that make sure that you have the right staffing and housing stock to meet demand for the community. If you click through, there's strategic growth. So being able to identify gaps that may be present in your service provision for certain demographics or for people with certain health conditions. If you're able to identify those gaps, then you can really tailor your service in niche ways, identify opportunities for leverage and efficiencies. If you click through, it also helps build trust. We know that partnership strength through data can help build trust. People, whether they're members, whether they're the MCPs, health systems, funders, other providers, when you show that kind of ability to find, access, and reflect back data and then take the step to say how you're using it to plan out your business or to change your operations, it really shows that you understand the local context and in ways that are more than anecdotal or gut. Um, I'll say that the anecdotal data is also very powerful too, right? That qualitative piece is also very powerful. So it's not intended to replace that. But when you pair it with more aggregated data sources, it really can yield more powerful relationships and partnerships. And the last bullet is where we started here, right? Sustainability. So really being able to correlate the work that you do with the health outcomes that we want to see is really key to long-term success of contracting here, as well as for the health of our communities. And so that sustainability piece is really a through line for us. If you go to the next slide, on business planning. So that accurate volume projection piece that I mentioned, providers who aren't utilizing their data appropriately, they're going to struggle to forecast service demand. So, how will they know how many people may be impacted, how many people may be coming through their doors? It will make them struggle with allocating resources efficiently. And it makes it hard to justify program investments, right? For folks to talk to their leadership and say, the reason we need to have more staff here is because this is the size of the need in the community. So even internally, it can be powerful in your business planning. Um, and and a lot of the complications here include like uncertain caseload projections. You might have this misalignment between service capacity and population need. You might have difficulty demonstrating return on investment to payers or to funders, and there's just limited visibility without data. So if you do one click, this is just an example pulling from the data that's in the second part in the appendix that Navneet mentioned, right? There are estimates of the number of people experiencing homelessness in San Joaquin and in Stanislaus. And then we know in Q2 of 25, which was the most recent data that we have through the CalAIM dashboard, these are the number of services that were offered to these numbers of folks experiencing homelessness. And so, with that kind of information, you can craft narratives, right, about whether you're providing adequate levels of coverage, whether the numbers that you're supporting are meeting the demand, whether you're at risk of saturating the marketplace, right? Of course, there's more information needed to be able to operate more strategically. So if you go to the next slide, and you could click once, this is the same line that I had earlier, right? Like we need to be able to identify gaps in specific demographics or in health conditions, a little bit more nuanced than what I just presented. And so if you click again, there's different types of data that are helpful to track, not just on kind of the numbers overall of people experiencing homelessness, but what is their housing need then? And what's the number of those individuals that are having a housing need? Then health complexity, right? Do they have at least one complex physical, behavioral, developmental health need with the inability to successfully self-manage, right? Like the ECM part of that definition. So being able to layer that onto the data you have on the number of folks with housing needs, which we know is usually that health complexity and housing need are pretty aligned many times. And then another piece of data that's required is enrollment status, right? Are they enrolled in Medi-Cal? Could they be enrolled in Medi-Cal? What's keeping them from it? Is another piece of data to track for your service provision within this context. And it's really that, you're trying to track all of these items because disaggregation is going to be the key. So you can click through the next four quickly. But it's, by geography, by population, by health need. So like, where are the hot spots? Are these folks who are justice involved? Are they aging adults? Are they children and youth? Are they individuals with serious mental illness or substance use disorders? Of course, this unlocks different funding pathways for them, as well as it unlocks what type of skill sets you may need on your team to be able to appropriately speak with these individuals, right? And to be able to be that trusted messenger if you're understanding the demographic, not just of folks you're serving, but of the need in your community, you'll be able to partner more effectively or bring folks on more effectively um, to provide better service. Um, and of course, that housing need piece that was brought up earlier, it's so that we're aligning like whether your service provision is needs to be in help finding units or is it in keeping units, right? Which are different types of services. If you click again to the next slide, and you can click, and this is where that piece about partnering more effectively comes in, because knowing that kind of data, knowing, are we trying to help people that have a particular health need, such as what I mentioned, like they have serious mental illness or their particular population, meaning they're justice involved, is that something that we want to shore up our skills in our organization to help serve and be able to use the right language um, with and for? Or is this an opportunity to partner? So this is where data can really help build trust with partners because it lets us communicate that, we know the size of the need, we know the demographic of the need, we know what their health conditions are, we know where they're coming from. And so our organization doesn't speak to justice involved populations yet, but we need to because of XYZ. So who can we partner with to get that both the level of trust that's needed or maybe just the skill upskilling that's needed. So if you click through 2 times, data can really help unlock that trust. It's key for service provision as well as for driving referrals. When you're partnering in that way with that organization, you're not only upskilling yourself, but you're able to help explain the services that you're able to provide and increase referrals. Um, it can also show where the need is, help people see themselves in it and see how the service can change their trajectory. And so if you click 2 more times, here are just some examples of evidence assessments that we've pulled and we've linked here and can share otherwise with you, but these are from Health Begin's own Social Needs Investment Lab, where we pull evidence based on a number of social needs. These were 2 that we have based on housing, where it shows that there's a significant decrease in ER visits and inpatient stays when housing is stabilized. There's some mixed literature out there on cost savings, but in terms of the decrease in visits and also the social impacts, it's there. We know supportive housing works. Same with rental assistance impacts. So by being an organization that thinks critically and can find resources like this to bolster your case, ultimately what you're doing is helping your community in how they're interacting with the service. And if you click once more, really supporting your own sustainability efforts, right? So correlating how housing services with health outcomes is not only, made possible through Medi-Cal at this moment, but it's really the reason why it's part of this CalAIM contracting. The reason is because we know that there's an actual benefit to the folks who are receiving these services. And while that might be evident within CalAIM, and that's why we have it, it can be crafted into a really robust story for other funding sources, which we know a number of you are also pursuing outside of CalAIM contracts. When you're thinking about sustainability, think about these data sources to be able to pull in a tighter narrative. Sorry, I'm a little under the weather today. Um, if you go to the next slide, here are a few local data sources. I'm sure folks have more, and I'm actually going to ask about what other data sources folks regularly look to support either their business case, meaning when they're trying to advocate for certain business choices within their organization or for when you're trying to improve your service provisions. Here are just a couple. But before I go to that discussion section, I just wanted to do like an example of how this plays out. And so if you click once more, um, you'll see at the top, this is not verified. This was me pulling from a large language model, right? So I'm not, this is AI generated. It might be right, might be wrong. Don't take this and run with it. It's not verified. I did just like a glance at it and it didn't seem so far off, but extra research needs to be done to verify that these numbers are actually right. But the point on this is that when you're looking at these metrics and you're looking at, for example, total unhoused, what this is able to give you are just the sheer scale of the population who are eligible for housing supports through ECM and community supports. So it gives you just a broad idea of what um, service provision needs to look like within your locality. Of course, you're one provider. What you could do at that point is go to the CalAIM dashboard that they have available and look at what are the number of housing providers in your area? How many are contracted? That information is publicly available through the state. And to see what does that make a viable business model for you to provide these types of services. This is also true for other we're using housing as a fulcrum here, but it doesn't have to be that. John, I see your hand raised.
Yeah, I just wanted to talk about, you bring up an excellent point in regards to the pit count. And
Mhm.
that's what, they're actually counting people that they find in the community. But this number is really, really a lot larger. This doesn't include people that are living on people's couches, that are in hotel rooms, that are staying in people's garages. So there's lots of people out there where we consider at risk or in what we consider in the gray area. So there's way more people out there that are in need of these housing services. So don't just think 4,000. We're thinking, I would say doubles that in these areas. So there's lots of people out there in need. And just to be truthful, a lot of those people don't even know they qualify. They don't even know that benefit of them sleeping on somebody's couch. They would benefit for getting that assistance to move into their own apartment. Because a lot of people do not have the 2,500, the $5,000 saved to move in. So those people in the gray areas would duly be thankful and need these services. So not just the 4,700, but there's a lot more out there. Just wanted to throw that in.
I love that reflection, John. I really appreciate it. And I'm curious, like, is there a data source that you know locally that gets to other estimates of this? I know that every locality I've talked to about homelessness or folks who are unhoused or need housing, they have this like concern about the point in time count and how it's not an accurate representation. I'm curious if there's anything locally that gets to better numbers.
Well, so a lot of people use, a lot of the medical organizations use it, an electronic health record system. And when they're registering, they ask people, the registration clerks will ask people, what is your housing situation? And a lot of that information is incorrect because a lot of our registration clerks themselves don't even know that they're at risk. So, somebody may very well be living on someone's house, on someone's couch, and they don't consider themselves homeless.
Mhm.
So these EHR systems, electronic health record systems, don't have accurate data because the information that needs to be provided to these members hasn't been put there. So there really isn't not another data source to find. But when working with the county, there's lots of EHR systems within. You have HMIS, you have EHR systems from different medical organizations, whether it be Dignity Health, whether it be the county. But like I said, it all starts from the time somebody is seeing their provider, giving that information to them so they have a better understanding of where they at because they don't know what services, are afforded to them through the health plans. And so we need to get that, we need to do better in getting that information out to people, and at least in a gray area.
I love that, John. And what you're describing is also a really great case for um, strengthening a partnership based on data. You see this number and you're like, that's not right. That's not an accurate reflection of people who are actually unhoused based on your understanding and your expertise in the area. And so where you go is thinking about health systems and how they're collecting that data. And you're identifying that there may be an issue with the way that that's being collected. That's a pretty good source of truth. But also, because people don't see themselves as unhoused if they're sleeping on a couch, maybe the question needs to be reframed. And that's a really beautiful way to strengthen a partnership, right? Is to go to them with data, say, this is what we're seeing based on point in time counts. This is what I'm seeing as a provider or other part of this community. And so what I would recommend to get our data right, and if you could provide this data, is to change the question a little bit to say, are you homeless? That also means that you're staying at someone's place. It means that you're staying in a car. It means that you don't have a stable address. Like these other terms that might be more locally relevant. I know when I was working in Baltimore, we used to ask people not where they live, but where do you stay? And that was for a different reason. That wasn't to get them housed, but to make sure we can contact them and to know when we asked where they lived, they might give a different address rather than where they stay. And so just wanted to say that what you're sharing is a powerful reflection on how data um, can be useful, where we can access it, and also how we can strengthen partnership and the actual data collection um, by speaking those terms. Appreciate you. Um, I think, the other pieces of this that are that kind of triangulate on what you're saying a bit, John, are like these pieces on housing deficit. So like what I had asked was, can you tell me how many, how shy the region is, that each county is on affordable units based on the need of the community. And so these are the estimates that were put out there. That San Joaquin needs almost 20,000 more units to fill their need, and Stanislaus needs almost 11,000 units to fulfill their need. I asked about, how cost burdened is the community, meaning, how much, what percentage of households are spending more than 50% of their income on housing. So you'll see 81%, not verified, in San Joaquin is spending more than 50%. That's not tenable. 75% of households in Stanislaus are spending more than 50% on income. You see a bit about average asking rent in these counties. You see what the housing wage is that would be required to be able to meet the average asking rent. And that's going to be much higher wage than probably most people are making in these counties. Um, and then you see a little bit about what the subpopulations are. So 50% have a history of justice involvement. And so for the housing providers in the room, how confident do you feel working with communities that have a history of justice involvement? How confident do you feel working with institutions, justice involved institutions, to be able to serve the population that needs these services? And then in Stanislaus, the percentages were higher around serious mental illness and substance use disorders. So similar questions there. As a housing provider in these areas, how well equipped are you to provide services to these populations? Um, so this is just kind of like a little bit of an exercise in what pulling this data together, finding the sources can provide you, right? So if a community supports provider uses disaggregated Medi-Cal enrollment data. They can project their caseload. They can identify, how many Medi-Cal members exist with the documented housing instability, how many of them have a complex health need, and then understand their own capacity. Maybe their own capacity is like a fourth of what the total need is. Um, and that means that there's a certain amount of a gap, right, that exists within the community to serve the population of need. This can also be used for targeted marketing, right? If we understand what the high need subpopulations are, then you know who to go to, who to partner with to be able to really identify where the referral sources could live. and launching targeted outreach campaigns with those partners will then improve your ability to reach the members that could use your help. And also that partnership, like I mentioned before, could be used to improve your organization's own skill in working with those communities. Um, and then this didn't go into geography at all, but that's another piece of this, right? To understand where the need density lies. And this is, again, probably some place where folks have, at the very least, like some sort of gut on where the need is geographically. But being able to really rely on data with the zip codes can be really powerful. I'll say that, um, again, anecdotally, for me, in the kind of food need area. I live in a part of Los Angeles where we have like a pretty privileged community. When the SNAP cuts went through last fall, I wanted to do some local work to help bridge gaps for some of my neighbors. And a number of my neighbors said, well, there's probably no need here because of the demographics of where I live. And so I was able to pull up data and share with my neighbors. We're a city of 30,000 people, and 3,000 of us have housing insecurity or food insecurity. So it's not as small as you think. It's maybe smaller than other areas, but that means 3,000 of our neighbors within this small locality do have a need, and that's meaningful and real. And so just an example of how kind of that geographic data can help support efforts. Of course, mine was not within the professional context, but I think the point standing. John, I saw you unmute. I don't know if you wanted to add on a point or if you were still unmuted from before.
Yeah, so ways that we can get more accurate data is we have to, consult with, different housing authorities within both counties. They have lots and lots of data in regards to housing, so they would be a prime source of gathering that information. Whether they give it or not, that's another question. But we should be reaching out to those type of agencies to gather, more informed data because they get applications daily, and so that would be a clear sign of somebody applying for some type of housing assistance is in need, and they would have that data. Unfortunately, the housing authorities' hands are tied at this time, and they're not providing any type of housing authority resources in regards to like vouchers or Section 8 at this time because of the I think it's the federal oversight. So there also would be, like I said, they would be a great source of that data, whether they give it or not. But that type of data is what's necessary, and maybe there should be some type of like collaboration between the health plans and the housing authority to get a good idea of how many of their members are actually looking for housing within the housing authority, and that would be a good point of understanding.
I love that, John. And I think I heard you say this too, like to reach out to them together. So I love the idea of the housing providers coming together in this way and making that ask. So it's not just John going in asking for himself and maybe even getting the data himself, but for folks to go in together. That's a great point. Um, and then Tiara, I wonder if you could come off mute if you feel comfortable and voice over um, your comment in chat. I see a lot of resonance to what you're saying there.
Invite Central Valley 211. Hey everybody. So I am on the more the ECM side, but I do have a housing navigator in office with me, and I constantly hear a lot of barriers as far as like clients not having any income at all, getting them applying to like SSI, SSDI. We all know that that is a months, possibly years process. So it's like, where's the in-between options for clients that are actively homeless, disabled as well, that have already used their recuperative or their respite, care services, like all their other community supports, like just for long-term housing, or I know like I've heard of HDAP. I feel like the referral just to get to these places is not clear either. Typically, we get the route of they have to go through 211, get into the coordinated entry system, and then honestly, nothing happens after that. They're just on this wait list. There's no updates to the client. Like, at least you've moved up a selection, or this has opened up here. Do you want to offer here? They're just sitting on another wait list. So they're getting these assessments done, and then they only have 6 months with CSS. And honestly, they utilize that 6 months just attempting or getting on wait lists, and there's never an actual outcome for them being placed or housed. And I feel like it's a big barrier for both counties. We do San Joaquin and Stanislaus County, and it's a barrier that we see quite often. It also impacts ECM because a lot of clients, they're like, hey, yeah, my health is important, but if I can't get out on the streets to start eating healthy, to be able to focus on getting to these medical appointments, to have somewhere for my kids to stay safely or my animals to stay safely, then I'm not really so concerned about going to the doctor and doing these follow-ups or getting the surgery done. Some of them need housing before they're even approved for their surgery, which is so harsh.
Medically tailored meal, they need to address.
Yeah, and then for the food insecurities, they can't get their meals delivered if they don't have a place of residence to have it delivered to. So there's like all these options, but it's really not feasible for the clients that we're looking at right now.
Yeah, thanks for voicing that over, Tara. And I saw additional folks kind of reacting as you were speaking. So there's definitely a high resonance here. I'm going to turn that question back to folks in the room. I'm not a housing expert, and I'm certainly not an expert in your region on housing. And so I'm curious. I don't know if this is what kind of the manifestation of what John was talking about with the housing authority being on hold and not being able to like process the applications that they're receiving, or if this is from predates kind of that time. But I'm curious how folks have been navigating this. That's question one. And question two is, how are you then advocating on it? So curious if there are, other housing providers here that are maybe some of the folks that are finding resonance in this. How are you navigating this?
So go ahead, Casey. Sorry, I couldn't find my raise my hand.
No worries. Go ahead. I don't mind.
I was just gonna say, we would have them connect with like their emergency contact, or if they have like a mailing address, find some other source. If our organization would be able to maybe have that address listed and individuals would be able to come and pick up those medically tailored meals, just kind of like think outside of the box to get them the services that they provide. I know most homeless shelters will allow them to receive. At least I know in Stockton they would, as long as they have an address and it can be delivered to them. That's how we would overcome that barrier.
And do you want to add to that, Casey?
I would say one of the things that we're doing is we are going through and attending the COC meetings in each county to find out who has like RRH funding that can help at least start the process to get our members in, working with those community partners so that way members can try and get housed. I know there's homeless prevention dollars. If you can find a provider that has it, fantastic. I know most counties, unfortunately, there really isn't one. Given the HDAP, HIP, the other H1 that's out there, it really is trying to work with my community partners, build those rapports and relationships so that way we have other mechanisms in place to try and get individuals housed. In addition to that, with TR coming on, trying to create a whole plan for how we can braid in all these varying different funding streams to support these individuals to get housed. I know Social Security is taking what seems like 786 years, give or take a day or two, to get individuals their funding, but it really has been working collaboratively more with our partners on who has what funding and how we can all work together to get these individuals housed, as well as doing direct landlord engagements. A lot of the times we're running into landlords want 2.5 times the rent. We know that those individuals that are on Social Security are at, a huge disadvantage. So it really is about engaging with the landlord, advocating, making sure that the landlord knows kind of once the member does get housed, we're still going to support them with stabilization to make sure that they're paying their rent on time. If there's any barriers or concerns that come up, we step in and start to work and advocate for the member and make sure that the landlord and member have a healthy relationship. So it really is utilizing all the resources that are at our disposal to try and get these individuals housed. And then once they are housed, keep them housed.
Thanks so much, Casey. And what organization are you with?
Turning Point Community Programs.
Turning Point. Okay. Thanks so much for sharing that. And Tiara, as you're kind of navigating this too, I mean, I welcome the three of you to connect outside of this space. And also it's giving us some things to think about for our in-person to help folks kind of troubleshoot and problem solve and think creatively together here. I'm way over my time, I believe. So I'm going to do the last slide just to like share, some of the questions first to think about here and then in future discussions, which is, so as you're thinking about the service provision, what data sources are you currently using to track either your wait lists, to Tiara's point, and then or your service capacity, and then how are you using data to tell your success story to funders? We heard some really beautiful qualitative examples of how the work that you're doing is working by thinking creatively, by working closely with landlords, and how does that kind of play out in the aggregate? How is this impacting folks even on the individual level or like in the aggregate? How many people? How much? What has that unlocked for their stories? All of those pieces I think are important as success stories to funders. And then curious, and folks can answer this part in the chat as I kind of turn it back over, but really curious about what data points is hardest for folks to find. What data do you feel like would really unlock either your service provision or your business planning or your strategy? And you're like, we just don't know what the answer to that question, as we talked about one that isn't immediately available, which is like the true number of unhoused. We have the point in time count, it's somewhat insufficient. There may be some other routes to getting data that's a better reflection of it, but still we know there's some downfalls to it. So as I kind of sign off here, curious for folks to add in the chat what data points are hardest for you to find. And part of why I'm asking that is for us to see if we can do some research to try to find good proxies before we meet next time in person. Thanks all, and I'll turn it back to you, Navneet.
Thanks, Sadhna. All right, so with that, we're gonna move to our MCP update. So I will pass it to Kat, and Kat, feel free to let me know when you want me to move it to the transitional rent slide.
Thank you so very much. This has been a very fruitful conversation. Nafnid, you can move it to the next slide, please. Okay, so I just want to provide some highlights on this transitional rent, and because I know there have been quite a few discussions. So we do have this two-pager from Homebase. Homebase is actually providing technical assistance and supporting statewide implementation of transitional rent. They offer trainings as well as webinar. They provide materials development and actually helping to connect the community with transitional rent stakeholders. So we do have these two pagers that do have very useful information, which I believe is going to be shared with everyone on the call. It actually defines what is transitional rent, what we need to know about transitional rent, as well as the questions that we have: who is eligible for transitional rent, and how transitional rent service providers their responsibility and what we need to look for. I'm not sure if you do have the two-pager. Nafnit, can we move to the next slide if you do have it? And that's it?
Yeah, let me just move
It's
that.
okay. I have it. I can just talk over. Don't worry.
Oh, okay. I was able to pull it up if you all can see it.
Okay. So, who is eligible for transitional rent? Medical members must meet three criteria, and these are the criteria that are listed. Who is eligible? Have one or more of the qualifying clinical factors, and be experiencing or at risk of homelessness, and be part of a specified transitioning population. Meaning, if you're coming out of jail or any institution, or you are unhoused, you have to have all these three criteria to meet eligibility criteria for transitional rent. And then how are transitional rent services provided? Managed care plans must partner with network transitional rent providers to issue rental payments, and in some cases, directly providing housing. And there are eligible transitional rent providers that we have here on this list. I'm not going to name all, but I'm going to start with the first two, which is county agencies. Managed care plans must offer county behavioral health agencies a transitional rent contract. And if they cannot provide it, they have to let the managed care plans know which provider they can actually contract with, or the flex pool itself. And then the next question we do have here is, do transitional rent providers have other responsibility? Of course, they do. Transitional rent providers are responsible for helping eligible members find an appropriate and habitable housing settings, units, review, understand, and execute their lease. So I did hear conversation on that process, that they're having difficulties finding shelter for unhoused people. Transitional rent, if they meet these criteria, then they will be working with the providers that are providing these services in the community. That will help them work with the landlord or property owners, and so that they can receive timely payment for their housing. And what are the allowable housing settings for transitional rent? That will be the next page. You're looking at, there are three settings that is allowable for transitional rent. You have permanent settings, then you have interim settings, and then you have the tiny home or a single room occupancy. You're renting a single room in someone's house, that you qualify as well. And then you're looking at, how does transitional rent interact with other CalAIM or housing services. Members that are authorized for transitional rent are automatically authorized for enhanced care management and the housing trio. They don't have to sign on to the program, but they're automatically enrolled in that program. Members are not required to use ECM or housing trio, but they become automatically eligible for once transitional rent is approved. Then the other thing that I wanted to actually point out is, are there any restrictions on transitional rent? The federal waiver authorizing transitional rent requires three room and board services, meaning recuperative care, short-term post-hospitalization, as well as transitional rent, are subject to global cap. This global cap limits assistance to no more than a combined 6 months. So with short-term post-hospitalization, recuperative care, and transitional rent, this roll overs to 12-month period. Then transitional rent is subject to an additional cap of 6 months per household during this demonstration period. So the spotlight is, transitional rent is going to be in collaboration with the behavioral health. The county behavioral health department will play a critical role in identifying and connecting eligible members to transitional rent, including people who are eligible for behavioral health services. And so the funding to support renter sustainability following transitional rent benefits. So behavioral health is actually part of the communication in transitional rent, even though there have been conversations that other funding sources will be exploited in this process. Nafne, that will be the end of my presentation today.
And do we have any questions for Kat? And I'll just get the slides ready in the meantime. See, Madison raised a hand. Do you want to feel free to ask?
Yeah, hi everyone. This is Madison from Lodi Memorial. I'm a housing support specialist. This isn't necessarily for Kaiser, but I'm just curious if anyone's been doing any transitional rent referrals lately. We're having a lot of issues I was kind of hoping that Health Plan or that Health Net would be here, but we're running into a lot of dead ends, assessments that don't go anywhere, and then being told that we can't refer, that it's only behavioral health case managers that can refer. So I'm wondering if there's any information, if there's a standard referral form, or even just some clarity, because I was under the impression these would be open door referrals. So if anyone has any information on that process, I would really appreciate it.
Addison, definitely I can take that question. With the transitional rent process, the referrals need to come from the behavioral, from the county itself. And our referral forms actually indicate that process. I believe HealthNet just updated their own referral form as well as Health Plan of San Joaquin. I will have the MCP reps reach out to you. Please, can you put your contact information on the chat so I can provide to HealthNet as well as Health Plan of San Joaquin. Thank you so much.
Yeah, thank you. And I can do that. So just to confirm, so because the referral has to come from a behavioral health provider, can clients not self-refer? Um, is there any process for that or any plans to start that?
Madison, this is John Cisneros. I would say I've been in contact with Sasha Jackson at San Joaquin County Behavioral Health Services. She oversees the transitional rent process, and so I would say this would be a great question to send directly to her. I can give you her email address if you would
Thank you.
like to get clarification.
Thank you.
Sure.
Yeah, I have been in contact with Sasha. I was just curious, if anyone else had been
Yeah,
working on
she
this.
has a process. I forgot what it was. I think we have to do referrals to directly to their assessment intake center, and then from there they will process them to see if they meet the qualification of an SMI. What I was told is that a lot of people are referring people that have moderate to low psychiatric issues, and those people would not qualify for those services because they have to reach a certain plateau, which is some serious mental illness. So they have to have, something that's at the far end of the spectrum to be able to qualify for some of the transitional rent services. And so that's the key. But yeah, I would say just continue to reach out to Sasha. She can point you probably in the right direction.
Okay, thank you.
Would you be able to send Sasha's information on the chat as well for me?
Sure.
Thank you.
She's gonna love me for this. Everybody email her, please.
I see Carrie, you also have your hand raised, so.
Yeah, hi. I can't speak for anything that's happening in San Joaquin County with transitional rent because we are only in contact in Stanislaus County. However, um, if it's helpful for anybody who's in Stanislaus County, we are working on making sure that our workflow includes an operational plan for people to self-refer for us to get referrals from outside of the health plans with behavioral health. So that is our workflow. We're working really closely with the behavioral health department in Stanislaus County. Obviously, they have to sign off on the mental health diagnosis. Like John said, it has to be the right criteria, but we do want it to be an open door, no wrong door situation where somebody can self-refer and then we go from there. So that is something we are working on in Stanislaus County. But again, I can't speak to what they're doing in San Joaquin County.
Any other questions before we move on? Okay. Just for the sake of time, we're gonna skip regional spotlights for now, but we'll have plenty of time for this that are in person. So I do want to move us to our next section on sustainability. So I'll just have Sadhna share some quick updates there.
Thanks, Navneet. Yeah, and I think this will be pretty quick. So this is a plea to take the sustainability assessment. We actually have some great responses already. I know John has also jumped in and encouraged folks to submit their assessments, which is great. And we're really excited about this. We're seeing really good responses that are informative. And this is like an example of one that ties back to the conversation we just had on data. So, one of the questions in the assessment was, if you do have a process for reviewing data, do you also have a process for determining what changes you want to make in response to what you learned during those reviews? The question above this was about, do you have a process for reviewing data? And that's why this is a follow through, but you'll see some of the distribution there. And the reason this is helpful is so as we come together in March, we'll be able to, identify folks that feel like they have a solid process for really taking that data and making it actionable. And we'll have a solid understanding of folks that need help in that way, right? And can really foster those conversations so that everyone is able to learn from each other and share back with each other. I'll tell you across the board, there are folks that are, fives in some sections and not in other sections. And so we'll be able to really pull together more meaningful conversations and pairings with some intentionality. For everybody that's able to do this assessment. We also have heard back that it's been helpful for teams to be able to take these assessments, just like what we said at the outset, because there might be disagreements within a team, within the same organization about how sophisticated you perceive your organization to be across any of these domains. And that's really helpful. When you can talk to your coworker and say, I don't think we're at a 5 on that. Why do you think we're at a 5 on that? And do some problem solving and knowledge sharing within your own organization as you take this together. So it's just another, plug for folks to take this. I forget when we were asking for it to be done by.
I think our deadline was last week, but I think we'll probably extend it for a little bit of time just so folks have the chance to complete it, especially if you're hearing about it for the first time.
Yeah, thanks, Navneet. And what we're really trying to work through is having enough time for us to then take the findings and do something meaningful for it when we meet in a couple of weeks. So, encourage folks to take it, and looking forward to being able to shape the conversation in March based on the results here.
Awesome. Thanks, Sadhna. Were there any questions from anyone around the sustainability readiness assessment? I know we've sent a few emails about it, and we'll make sure to include it in our follow-up email, but just wanted to pause really quick in case there were any. All right. Okay, so with that, we're going to move on to our last section of today, our next steps and closing. So have some exciting updates on our in-person session that I know Sadhna had shared about. So I'm excited to share that we do finally have a location for our in-person session. So it will be happening on Thursday, March 12th from around 10 a.m. to 2 p.m. We may adjust the time slightly, but that is the time block that we are aiming for. And it will be happening at San Joaquin Delta College in Stockton. This is one of the few spaces that could accommodate our group without various different hurdles. And appreciate all the folks that I know I've coordinated with quite a few folks to find a location. So just want to also shout out that I appreciate everyone who reached out with suggestions and connected me with folks. And also Megan, who's not on the call, but supported while I was out to get this squared away. So I am going to put the link in the chat if you didn't see our email last week. If you would like to register, do want to say that sometimes spots fill up pretty fast. So if you are interested, highly encourage you to register now. Similar to our previous in-person sessions, this is open to all local health and social service organizations across San Joaquin and Stanislaus County. So strongly encourage you all to attend. Similar to our previous in-person sessions, we really like to gear these sessions towards helping to support and build relationships among local providers and sharing best practices. I know, as Sadhna alluded to, we will also be spending some time kind of working through our responses from the Sustainability Readiness Assessment and really with a focus on sustainability efforts. So want to also host some dedicated leadership discussions around that as well. So have that information in the chat. We'll also share it via email. But with that in mind, we also have a call to action / we need your help in helping us identify who the right leaders and decision makers are from your organization that could help support our sustainability efforts as we kind of look at 2026 and beyond. Since we don't have too much time, I won't spend too much time asking you all to unmute and share in the chat, but if you do have suggestions or folks that you want to make sure that we invite to this in person, please definitely either put it in the chat or reach out via email, and we'll make sure to send that invite to folks there as well. Sorry, I saw a chat come through and it totally distracted me. John is the leader to get the recommendations from. Okay, got it, Casey. Well, we are working with John, so I guess we're a step ahead. But encourage you all to take a moment to just think through this, and if you have folks that you want to make sure are invited from your organization, to definitely let us know. I know we have a few minutes and we did skip over regional spotlights, but do want to pause if anyone had any updates on either events that your organization is hosting or any successes. I think it's always helpful to kind of spend some time focusing on the positive and the things we've accomplished. So, gonna pause if anyone wants to share anything or have any questions based on what I just recently talked about. I know you all aren't a quiet group based on the earlier discussion, so would welcome if anyone wants to share anything.
I'm happy to share it's a little bit out. Save the date for April 25th. Friends Outside will be hosting our second annual Second Chances Month event. We're a JI service provider, but we did this last year. It was a big success. It's a service fair, a job fair, expungement clinic. Anyone with a justice impacted background who needs resources, it's a free event at the Stockton Civic Auditorium. So hope to see you all there.
Awesome. And Susan, do you have a flyer for that event, or is it okay if I just circle back with you via email to get those
Yeah, I have a flyer. Can I drop it in the chat? Is that
Yeah. Yeah.
yeah, give me just a second. Let me do that right now. Thank you.
Hi, quick question. Will there be tattoo removal that same day, or is this something separate, just the expungement?
Great question. This is something separate, though the tattoo removals happen regularly. I can drop my email in the chat and let you know when the next one will be, but that won't be combined with a specific event.
Okay, thank you.
Awesome. Yeah, I'll definitely be sure to share that information out. I see a comment in the chat. Will a recording of the Zoom be? Yes, we will share the recording of the Zoom as well as just reshare the slide deck. All right. Any other announcements from the group? Right. Okay, I think that's it for us for today. Really appreciate everyone's active discussion. I feel like I learned a lot as well. And I know I have a few things to follow up on that I noted in the chat. So I'll be sure to do that. And with that, I think we can go ahead and officially close out for today. Appreciate everyone showing up today and looking forward to seeing folks that are able to make it in our March in person. So in a few short weeks. Have a great week. Bye, everyone.
Bye. Thank you.
Thank you.